Welcome, everyone. I am absolutely thrilled you're here today because we have a truly fascinating explainer lined up for you. We often think of corporate sustainability as just carbon emissions or like supply chain recycling. But today, we're looking at something profoundly human. We're examining how major pharmacies and drug retailers measure something called patient health outcomes. It's all based on the rigorous SASB sustainability accounting standard for the industry. Okay, let's dive into this. Here is our roadmap for today. 1. The drug retailer standard. 2. The last line of defense. 3. Measuring medication adherence. 4. Preventing prescription errors. 5. The financial cost. And 6. Good health, good business. Let's get started. Section 1. The drug retailer standard. When you walk into your local pharmacy to grab some toothpaste and a prescription, it might just seem like a standard retail store, right? But behind the scenes in the world of sustainability accounting, this industry is held to incredibly specific, rigorous standards that go way beyond just selling consumer goods. If we look at the official SASB table of sustainability disclosure topics and metrics for drug retailers, there's a fascinating topic listed right at the bottom: patient health outcomes. This proves that the human element, how a customer's health actually fares after they leave the store, is not just some nice-to-have PR talking point for these companies. It is a vital, standardized metric that investors and analysts use to judge the health, responsibility, and viability of the company itself. Section 2. The last line of defense. And this brings us directly to the human beings at the heart of this accounting standard: the retail pharmacists. They are the essential bridge between a simple commercial business transaction and critical public health. The SASB standard actually captures this responsibility perfectly. It states that drug retailers and pharmacists provide medications and are, quote, often the last healthcare professionals to interact with patients before medications are consumed. Just think about the gravity of that for a second. After the doctor's visit, after the diagnosis, the retail pharmacist is the final safety check. They're literally the last professional voice a patient interacts with before taking a potentially life-altering substance. So what does this all mean? Well, the crucial point is that in this specific industry, human care and corporate success are undeniably linked. Enhancing patient outcomes directly protects long-term shareholder value. If a pharmacy chain is excellent at educating patients and keeping them safe, they avoid massive liabilities, they retain loyal customers, and their stock remains a stable, attractive investment. Patient safety is, quite literally, the ultimate shield for brand value. Section 3. Measuring medication adherence. Let's look at the proactive side of this equation. How do drug retailers actively improve public health on a day-to-day basis? They use a very specific metric for this, officially coded as HCDR 260B.1. It's called the first fill adherence rate. This is simply the percentage of customer prescriptions requiring refills that were actually refilled at least once after the initial fill. Basically, are patients following their healthcare provider's orders? Are they coming back to stay on their medication? This tracks the patient's conformance with the recommended timing, dosage, and frequency over the whole prescribed length of time. But retailers aren't just passively measuring this rate. They're required to actively report on the strategies they use to increase it. Notice the sheer variety of these proactive approaches. We're talking about sending out automated refill reminders, utilizing advanced tracking technology for orders, providing deep educational resources, and even engaging in cultural and language training, or increasing pharmacy staff diversity to better connect with their specific communities. These are highly measurable, strategic corporate efforts designed to boost proactive public health. Section 4. Preventing prescription errors. Okay, if medication adherence is about actively encouraging the good, this next section is all about rigorously preventing the bad. We're talking about avoiding critical, sometimes fatal mistakes. The key metric here focuses on what the standard calls a dispensing error. By definition, this is a discrepancy between the medicine indicated on a prescription and the medicine that the pharmacy actually delivers to the patient. And it's not just about handing over the wrong pills. This also includes dispensing a medicine with inferior pharmaceutical or informational quality. It is a direct failure at that critical last line of defense we talked about earlier. To rapidly prevent these dangerous discrepancies, the standard requires companies to report on their preventative operational policies. These include immediately implementing strict quality assurance protocols, utilizing highly accurate barcoding systems, significantly increasing process automation to remove the chance of human error, and radically improving back-end data verification systems. Essentially, retailers have to build a robust physical and technological fortress around the dispensing process just to keep patients safe. And this brilliantly illustrates the two-pronged approach drug retailers must take. On one side, you have proactive care, improving public health through open communication and tracking to boost that first fill adherence. On the other side, you have preventative care, avoiding direct harm through rigid protocols and automation to eliminate dispensing errors entirely. It is a really delicate, complex balancing act between active human encouragement and strict, uncompromising corporate safety nets.
Section 5. The financial cost.
But what happens when those preventative safety nets fail? The standard forces companies to be completely transparent about the severe financial realities of dispensing errors. This is tracked under metric HCDR 260B.3, which requires companies to disclose the total monetary losses resulting from legal proceedings tied to prescription dispensing errors. This is reported in their presentation currency. We're talking about the hard financial hit from civil actions, regulatory proceedings, or criminal actions brought by individuals or the government. When a pharmacy makes a dispensing mistake, it costs them dearly. And it's not just about listing a dollar amount on a balance sheet. The disclosure requirements are incredibly deep. Companies must publicly detail the exact nature of the loss. Was it a settlement, a court judgment, a guilty plea? They must explain the context. Was it the wrong medicine, an incorrect dose? Crucially, they also have to disclose the specific corrective actions they've implemented in their operations or training to ensure it never happens again. And note, this figure excludes their own legal defense fees, so it is a pure reflection of the penalty and liability.
Section 6. Good health, good business.
Let's pull all of these threads together. From the macro-level accounting standard all the way down to the individual pharmacist handing over a prescription bag, there is a unified theme. We can call this the dual mandate. In the drug retail industry, doing good for public health inherently means doing well for financial performance. By operating as an effective, communicative last line of defense, pharmacies don't just save lives. They prevent massive legal losses, they build incredible brand trust in their communities, and they secure the long-term returns that investors are looking for.
Thank you so much for joining me for this explainer. I really hope it gave you a completely new, data-driven perspective on the fascinating business of pharmacy, which leaves us with a critical lens to look through the next time you pick up a prescription. Think about the systems, the communication, and the care you receive at the counter, and ask yourself, how effectively is your local drug retailer protecting both your public health and their shareholder value?